I mean, it really depends on how bad, that infection is. If there's gross pus leaking out. I mean, if there's pus, I usually try to take everything out, remove it. Then I would have a conversation before the surgery with the patient with what are the risks. Any patient who has an infection, I tell them, like, hey, we have three options. I can take everything out and come back another day. I can, take everything out, place it malleable, right? Wash everything out, place it malleable, but you have about a 15-20% chance that this is going to fail. And then I can also take everything out, replace it with a three-piece inflatable implant again, but you have about a 50% chance at best that this can work, or this can eventually work. And usually I let the patients decide. As long as they're aware of what they're getting themselves into, we can make it happen. You don't always have to. I mean, it is possible. I mean, I just want to rephrase this. It is possible to replace it with a three-piece. I've done it before, and they've done well. Of course, in these patients, I need to make sure what infection we're dealing with, what that culture showed, and I will keep them on antibiotics probably for a little bit longer, maybe 2 or 3 weeks, rather than just 1 week afterwards. And also, of course, also evaluate what are the risk factors. If this guy's like an uncontrolled diabetic, I mean, don't shoot yourself in the foot. If
Yeah.
the guy's healthy and doesn't have any risk factors for infection, then it's something that we can definitely consider.
And in those cases, you do a washout. You try to remove the biofilm. What techniques do you use to clean those corporas?
So I am one that I do washout. I use Iricept that has chlorhexidine. It's like, I think it's like 0.05%. So I use Iricept with antibiotic solution. I'm just basically alternating both. I have a really good friend, Dr. Alex Tatum in Indianapolis. He uses another solution called chlorpactin, which is also, it's basically like bleach, but tissue friendly. I want to use that in the hospitals where I work at. They just don't have it available yet. And as soon as we have it available, I'm definitely going to start using it. I do not use betadine. I do not use hydrogen peroxide. I believe these will damage the tissues, and they're really not that great. So again, I use whatever is available. But again, it's just a matter of actually irrigating those tissues more than what you're actually irrigating it with. So the most important thing is you make sure that you wash out everything very well. I do not remove all the biofilm. For example, I mean, sometimes I place, for these infected implants, I wash everything out very well, and I place the implant within that same surgical capsule inside the corporas. There is, Dr. Shair, again, the guy that doctor from
Yeah.
Egypt.
Egypt.
He also used the extracapsular tunneling, so basically creating a new space behind that capsule in order to avoid contact of the new implant with the surgical capsule. And that's something that works for him in several cases that he published. So again, there's multiple things that we can try. For example, another thing, like for these infected IPPs, Carry On, he publishes Carry On Cast, which is basically like a spacer. What he uses with that is a solution called Stimulin, which is calcium sulfate, and you can actually combine it with antibiotic solution. So it's like a powder that you just combine it with vancomycin or tobramycin or whatever other powder antibiotic. You mix everything together, you get the water in or saline, and it will create this paste that forms like a cast. And this cast usually dissolves within 6 weeks. So basically you can leave that cast in there and come back 6 weeks later. So it will create like a spacer inside to make sure that corporal tissue doesn't collapse and start causing fibrosis. So whenever you come back, it's going to be easier for you to get an implant in. That being said, it's easier said than done. I believe that right now he's working on a new protocol to
Yeah.
see how he can optimize that, because you have like a 5-minute window to get that cast in, and it will create a mess if you don't
Yeah.
do it quickly.